take a step back and sort of say a little bit about sort of what was the reason for developing these tests and what's our need for them. We currently have very good melanoma staging systems based on over 50,000 patients with their tumors and their clinical information. And so we can very well predict, simply based on the depth of the melanoma tumor and a few other of the factors that would be in the pathology report, what that patient's risk of metastasis, recurrence of metastasis, and death would be. However, we know that there are patients who have very thin melanomas that would be predicted to have low risk of metastasis that ultimately do have metastasis. And conversely, other patients that have a positive sentinel node biopsy or a deeper primary tumor, and they actually end up doing okay. So within our current staging prognostication, we know that it's not perfect, and there are patients that fall through the cracks in terms of our prognostics. And so we'd really like to know if we could, identify those patients with a molecular test who might be at higher risk than we might otherwise predict that they would be, and maybe we would more carefully surveil those patients. Similarly, there are a lot of patients who get aggressively treated for melanoma, and maybe they don't need such an aggressive treatment. Maybe they don't need a sentinel lymph node biopsy, most of which that are performed are negative. And a lot of patients are treated for with what's called adjuvant therapy. So they're given immunotherapy because they're at risk of recurrence, but at the current time, they actually don't have known metastatic disease. And so if we can identify which of those patients maybe could be spared a very toxic and expensive therapy, that would be good as well. So that's kind of the backdrop. And so several companies have developed these tests, and they've gone through various stages of validation. Maybe I'll stop there and ask, let you give your next question. But I could go on in terms of sort of going to some of the pitfalls and problems with the tests.
No, I think let's step back. Maybe no, this is a perfect explanation. Give the great background. The reason why those tests came about is I think some of the statistics that we should mention is about 3 to 5% of thin melanoma that can have eventually metastasis spread to the lymph node, etc. And when we talked about sentinel lymph node biopsy, about 5 to 7%, of those patients that can have similar type of meds issues, and that's why the genetic expression profiling, this new technology, is sort of developed, right, and to help us to sort of fine tune the prognostication.